Hi everyone, Dr. Brian Steiner here at Wilkins Spinal Care in Mount Pleasant, PA. This week we're going to continue our journey on the feet and focus on one specific condition called plantar fasciitis. The reason why I'm talking about plantar fasciitis separately versus last week when I talked about the foot in general is because there's so much about plantar fasciitis. It's very common. It's so common that 10% of the American population have plantar fasciitis. So this week I'm going to talk about what it is, different exercises you can do to treat it, and what we can do to help as well. So first thing, what is plantar fasciitis? Plantar fasciitis, and I'm actually going to sit down for this part. Plantar fasciitis is when the inflammation of the fibrous tissue below the bottom of the sole of the foot right here becomes inflamed and creates a lot of pain. Now, a lot of patients who have plantar fasciitis pain, it's classic here into the calf, or the heel up into the calf. That's the most common thing. Foot, heel, calf. But people who have plantar fasciitis, some people say, I can have it on the top of my foot, it goes down my toes, it goes to the side of my feet. It can go anywhere. But again, the most common spot is the sole, bottom of the foot, the heel, and the calf. So what can you do to help? What's it due to first? Is plantar fasciitis is due to a number of things, but the most common things are increase in activity, running on weird surfaces, grass, concrete, asphalt, whatever the case may be, improper footwear, trauma. Those are all common things. Now, are those all exclusive to plantar fasciitis? No, you can get plantar fasciitis, just what they call idiopathically. There's no cause to it, it just happened. So, what are different things you can do to treat plantar fasciitis? There's a couple different exercises that I'll show you that you can do to help stretch out that calf. Most commonly, what happens in plantar fasciitis is morning stiffness. That's the most common symptom of plantar fasciitis. A lot of people are real stiff in the morning, and as the day goes on, their feet get better because you're stretching out that bottom of your foot by walking or running, whatever the case may be. Now, does that mean that the more activity you do, the better that plantar fasciitis will be? No. That's the vicious cycle about plantar fasciitis. There can be pain within activity, and then there can be pain with activity. So if you're experiencing those symptoms, try these stretches out and try these recommendations before you go to more drastic measures. So here's the first and most common one. Now, this is just a little lumbar roll. You don't need this to do a cat or a plantar fasciitis stretch. Here's the most common thing you want to do. Use two things. One, a tennis ball, or two, a frozen water bottle. Take a water bottle, put it in the freezer for a night. Next morning it should be frozen. You want to have something firm. These lumbar rolls, they're firm, but they might not be firm enough. This is all you want to do with that tennis ball or that frozen water bottle. Take the bottom of your foot and just roll it, just like this, constantly. Okay, and you want to apply a little bit of pressure to it. I don't want to put too much pressure on this because it will break. But roll it just constantly along the bottom of your foot. Which one? Some people have plantar fasciitis in one foot, some have it in two. Some people that don't even have it on both sides, they're going to do both sides just to prevent it from happening, which is perfectly fine. So, again, water bottle or a tennis ball. I'm just doing this because it feels really good. So that's one stretch you can do. Another really common stretch for plantar fasciitis. Biggest thing you want to do is you want to stretch the foot. That's the goal that we're trying to get. TheraBand. Okay, there's different levels. There's this yellow one's just a real light one. There's other colors. The different colors have different resistance. This is just the lightest one. I wasn't getting super crazy this morning. But if you think you need more resistance, get a bigger resistance band. Go to the bottom of your foot here, and just all you want to do, you want to get it to resistance. Now, obviously, this is light for me. I should have a thicker resistance. I just did something light. Stretch your foot down and up, down, up. Okay? So, and just do that along the whole bottom of your foot. We can give you some of these. They're real cheap. You can find them on Amazon. You can probably get them cheaper here. So if you ever need a pair of TheraBands, we can get you a pair. Like I said, they're really helpful. They're good for stretching. They're good for other exercises too. So it's not just for plantar fasciitis. You can use it for other things too. Another common stretch you want to do, this one I kind of can't show you too well. I'm going to have my camera lady kind of step back a little bit here. Here's what you want to do. You want to do calf raises. Okay, I'm on my tippy toes, drop your heels back. That's kind of hard to do when you're on a flat surface on the floor. So what you want to do, you want to go to your bottom step of your house. Grab a railing. If you don't have railings, I don't recommend you do this because there's a greater chance you could fall. I'm going to try not to fall in this video, but what you want to do, and this might not work because the ceiling's really low here, you want to go on your tippy toes and then draw all the way back. I feel a nice stretch in my calf muscle, okay? So why you want to stretch here, that Achilles tendon runs all the way down, attaches right here, and then that causes a lot of inflammation coming from that plantar fasciitis. So that's why I recommend that stretch there, calf stretch. If you can find another calf stretch, go for it. You know, another one you can do is you can do a lunge, okay? Lunges, you're gonna feel that in your calf, okay? So that's another good stretch that you can do for plantar fasciitis. So what are other options you can do? One option, and this is something that everybody should be doing, is get new shoes frequently, okay? Again, shoes are very important for your feet, okay? So you want to make sure you have a shoe that's very supportive, and you want to make sure that you change out your shoes often. How often? I'm going to talk more about that in next week's video, but just to give you a rough idea, it just depends on your activity level. Some patients need to change their shoes every year, some need to change them every 6 months, some need to change them every 3 months. It just depends on the activity levels that the patient has. Another good thing, and we're going to talk about this in next week's video as well, is find a good pair of orthotics. I'm actually going to go into great detail next week on orthotics that we have, and I'm actually going to demonstrate how we fit patients for our orthotics. Another good thing people ask us about, you know, can we get like a night splint specifically for plantar fasciitis? Yeah, you can. Do they work? I mean, they help, but I've never really seen many good research articles on them. You know, what do you do if this stuff doesn't work? You know, the next step would be that you go to a podiatrist. You know, they're either gonna put injections in you, which seldom ever works, or they're gonna cut that fascia off and, you know, get rid of that inflammation immediately. Sometimes those don't even work, but that's a lot more drastic. That's a lot more rare. That's not something commonly seen. What can we do to help? We adjust feet, okay? And I know this is weird, I know it's gross. Adjusting feet is my favorite thing. I love it. It's very easy to do. And again, I explained in last week's video, the foot is the foundation of the entire body because it holds our entire weight from ankle to forehead, or to your head. So it's very important to get those adjusted too. Is that something I mainly focus on? No. But if I feel someone needs a foot adjustment, yeah, I'm going to adjust the foot for sure. So that's all I have for you guys this week. If you have any questions about the stretches, about what plantar fasciitis is, how you treat it, give me a call. I don't have a problem answering any questions. Otherwise, next week we're going to talk about proper footwear. We're going to talk about orthotics. I'm actually going to do a demonstration on that. And that will be the end of my little foot series. Then we'll move on to something else. But that's all I have for you guys this week. If you have any questions, feel free to give me a call. Have a great day.